Good evening, everyone, and thanks a lot for joining again for the seventh session of our program from OIAH, the skin course. So we have covered many things, and I hope you have been taking advantage of all the sessions we have been organizing from various lecturers and various renowned homeopathy doctors. So today's session is by Dr. Hira Aggarwal, whose introduction we'll give once he is coming to the session. So initially, before wasting time, I know skin is such a vast topic and we don't want to waste and lose any opportunity to give the maximum whatever we have learned in our experiences. So today we'll be having a short discussion about a very commonly found skin lesion, which is called as wart, which there is no homeopathic doctor, or in fact, there is no physician who would not have come across any case of wart. Definitely everyone would have seen one or the other way of the warts. कोई ऐसा फिजिशियन नहीं होगा जिसने कभी वार्ड नहीं देखा होगा या उनके पास कोई पेशेंट नहीं आया होगा. इनफैक्ट इट्स अ रिनाउंड थिंग, और सब कोई जानते हैं कि अगर किसी को वार्ड हो जाता है तो वो सबसे पहले होम्योपैथी की तरफ जाते हैं. सो इसीलिए वी विल बी टॉकिंग अबाउट लिटिल अबाउट वार्ड, कौन से तरीके के वार्ड्स होते हैं, व्हाट ऑल टाइप्स ऑफ वार्ड्स वी हैव, एंड कौन सी होम्योपैथिक मेडिसिन डिफरेंट वार्ड्स के लिए यूज होती है. तो नॉर्मली एक प्रैक्टिस होती है कि अगर किसी प्रैक्टिशनर ने देखा कि वार्ड है किसी को, तो वो सोचते हैं कि थूजा दिया जाए. बट थूजा इज नॉट द ओनली मेडिसिन फॉर वार्ड. टुडे विल डिस्कस अबाउट व्हाट आर द वेरियस मेडिसिन ऑफ वार्ड एंड हम किस टाइप के वार्ड में कौन सी मेडिसिन सोच सकते हैं. तो सबसे पहले व्हाट इज अ वार्ड. व्हाट बेसिकली इज मेंट बाय वार्ड. कई बार होता है कि पेशेंट हमारे पास आते हैं एंड वी कम अक्रॉस विद द पेशेंट्स जिनका वो बोलते हैं कि मुझे कॉर्न हो गया है, बट एक्चुअली वो कॉर्न नहीं होता. इफ यू क्लियरली ऑब्जर्व इट, इफ यू हैव अ वेरी कीन ऑब्जर्वेशन, यू विल गेट टू नो इट्स नॉट अ कॉर्न, इट्स लाइक अ वॉट. So we should know how to differentiate wart and other type of dead skin lesions. So we should know about कि wart को किस तरीके से हम categorize करते हैं और किस किस तरीके के appearances में wart मिल सकते हैं. So normally जो wart होता है वो it's caused by a virus. इसको हम wart का एक दूसरा नाम, the other name of wart is verrucae, VERRUCAE. कुछ लोग इसको वेरूशिया भी कहते हैं, but commonly called name is verrucae. जो इसका वायरस होता है वो एक डीएनए वायरस होता है, और उसका जो मेन साइट होता है ग्रोथ का, इट्स फाउंड ओनली इन द एपिडर्मल रीजन. वो और डीप सीटेड नहीं रहता है. इट्स ओनली सुपरफिशियली प्रेजेंट इन द एपिडर्मिस, एंड व्हाट कैन इक्वली अफेक्ट एडल्ट्स एंड चिल्ड्रन, एंड it is a contagious disease, but it has a very very low infectivity. Therefore a casual contact, किसी को वार्ड है आपने उसके वार्ड को छू दिया, आपको नहीं होगा. Mainly the virus enters into the skin through minor or microscopic injuries. तो अगर छोटी सी या माइनर इंजरीज है, उससे ब्लड ऊज हो रहा है, उससे कोई डिस्चार्ज ऊज हो रहा है, उसके कांटेक्ट में अगर आप आ गए हैं, देन इन दैट केस it is contagious. Now usually the virus like हम जब देखते हैं warts को, so what kind of appearance we see? Sometimes we see them as a very small kind of a wart. कभी कभी रफ उनके एजेस होते हैं, कई बार बहुत फ्लैशी एंड राउंड अपीयरेंस होता है. Sometimes they are pink in color, sometimes they are having the skin color. So there are several types of warts, and some of the most common type of the wart which we come across is flat warts, which are usually small और थोड़े से ही स्किन के ऊपर होते हैं, बहुत ज्यादा बड़े नहीं होते हैं. But there are some warts which are called as filiform warts. Those are usually long, narrow, filamentous. तो जो हमें flat warts मिलेंगे, flat warts will be like flat warts ऐसे होते हैं. This is the common wart which you see. Filiform wart का हमेशा जो उसका बाहर का सरफेस होता है, it's very very rough, and you can see here बहुत rough skin and dry skin होता है. These type of warts are called as filiform warts. इसके अलावा जो हमारे warts होते हैं, जो filiform warts होते हैं, वो usually हमें कहाँ कहाँ मिलते हैं? These are usually found मोस्टली ऑन द फोरहेड, फेस पे, कई बार स्कैल्प पे भी मिलते हैं, वेरी रेयरली फाउंड ऑन दी हैंड्स एंड ऑल। हैंड्स पे हमें यूजुअली कॉमन वॉर्ड्स मिलेंगे। अपार्ट फ्रॉम दैट फिलीफॉर्म और कॉमन वॉर्ड्स जो कि बहुत कॉमनली फाउंड होते हैं, इसके अलावा हमें इस टाइप का अपीयरेंस के भी वॉर्ड मिलते हैं जो हम दूसरे डिजीजेस से कई बार कंफ्यूज कर सकते हैं। बट दिस इज एन एग्जाम्पल ऑफ फ्लैट वॉर्ड। द पर्सन विल नेवर कंप्लेन ऑफ कि उसको कोई इचिंग होती है, ना उसको कोई ये बढ़ते हैं, ना ये ऐसा होता है कि किसी सीजन में बढ़ गए किसी में कम हो गए। बहुत स्लो प्रोग्रेस होता है इनका। इसके अलावा जो फोर्थ वॉर्ड है दैट इज कॉल्ड एज प्लांटर वॉर्ड, जो नॉर्मली हमें, एज आई सेड इन द इनिशियल लेक्चर, कि कई बार हमें पेशेंट आके बोलता है मुझे कॉर्न हो गया है, तो वो कॉर्न का अपीयरेंस देते हैं, वो कंप्लेंट कॉर्न की करते हैं, बट एक्चुअली दोज आर नॉट कॉर्न, दे आर कॉल्ड एज प्लांटर वॉर्ड। नॉर्मली यू कैन सी हियर ऑन द स्किन, हियर ऑन द सोल रीजन पे नॉर्मली हमें ये मिलते हैं। एंड समटाइम्स बिकॉज हम अपने सोल्स को यूज करते हैं बहुत फ्रीक्वेंटली, अगर हमारा फुटवेयर ठीक नहीं है, इन दैट केस दीज कैन बिकम पेनफुल बिकॉज उनका वियर एंड टियर बहुत ज्यादा होता है, सो दे कैन बिकम पेनफुल एज वेल। इसके अलावा ऑन द साइड एजेस ऑफ द नेल समटाइम्स वी गेट द वर्ड्स which is called as periungual wart. Such type of appearance if you get, this is called as mosaic wart. Sometimes on the tongue or in the oral regions we can find it. These are called as oral warts. And we can even find on genital, as Dr. Deepak earlier had discussed one case which he treated by the single dosage of Sabina, and the patient's genital wart were very completely almost gone. So such type of appearance will be of genital warts. So we should know properly कि हम जो treat कर रहे हैं वो wart है या कुछ और है. सो इसीलिए वार्ड्स को प्रॉपरली डायग्नोस करना, उनका प्रॉपरली एग्जामिनेशन करना बहुत जरूरी है. इट्स नॉट ओनली बाय द वर्ड्स ऑफ द पेशेंट हमें जाना चाहिए. कई बार होता है कि पेशेंट आके बोलता है कि मुझे वॉट है, पर जरूरी नहीं है अगर पेशेंट कह रहा है वॉट है तो वो वॉट ही. सो यू हैव टू बी क्लियरली फर्स्ट बी कॉन्फिडेंट अबाउट कि जो आप ट्रीट कर रहे हैं वो वॉट है या कुछ और है. सो इफ यू गेट एनी ऑफ दीज अपीयरेंसेस, डेफिनेटली यू आर ट्रीटिंग अ केस ऑफ वॉट. Yes, Dr. Deepak. Next slide. So this is how you will be getting the warts. This is called as a common wart. Otherwise, the scientific name is called as Verruca vulgaris. Normally, we find it on our eyelids, this region, or we can find it on the hands, on the fingers like this. This is something which in my practice, I have come across many cases in which there were warts on the fingers, on the hands. These are usually single, very rarely found in too much of bunches. Even if they are found multiple, but वो थोड़े अलग अलग होंगे, वो एक bunch नहीं बनाएंगे. They'll be little separated from each other. Apart from that, common warts के अलावा हमें जो warts दिखते हैं, those are called as plain warts, जिनका दूसरा नाम होता है verruca plana. Verruca plana, they are usually present on the dorsum of the hand or face and usually found in children. Their color is mostly skin color. वो normally red या किसी और color के नहीं होते हैं. Slightly raised from the normal skin alignment. Then they are flat. The top of the wart is usually flat. Such type of wart we call as plain wart. ऐसे cases में medicine called Antium crudum had been very successfully seen. Even causticum has been very successfully used to treat plain warts or verruca plana. Apart from that we get, जैसे कि हमने पहले देखा, filiform warts, जो कि usually जिनके edges बहुत sharp होते हैं, rough होते हैं, very irregular surface, and they're usually seen on neck, face, scalp, forehead. And they can be differentiated from the skin tags. With skin tag normally जो होता है वो उनका smooth surface होता है, base narrow होता है, और वो सिर्फ neck, axilla और groins में मिलते हैं. So the skin tags which we come across, those are different from the filiform warts, और जो warts आपको normally face पे, neck पे मिलते हैं. So this is how you have to differentiate. हमेशा wart का जो face पे उसमें मिलेगा उसको हमें irregular edges मिलेंगे. Next is, as we discussed earlier, plantar warts. These are found on any part of the sole, and sometimes these warts can be painful. They are usually skin color, and उनका area एक well defined area होता है. थोड़ा सा depressed part हमें मिल सकता है with the irregular margins. These are usually differentiated from corns is that they will be having a very clear cut margin. जो कॉर्न्स होते हैं या कैलोसिटीज होती हैं हमारे सोल्स पे, they will have a very smooth surface and they are continuous with the surrounding skin of the sole, जो कि वॉर्ट में नहीं मिलता है. वॉर्ट का एक सेपरेट मार्जिन होता है, whereas कॉर्न का उनके साथ स्किन के साथ ब्लेंड होगा. Then okay, this we have discussed, Dr. Deepak. We can go to the next slide. Yeah, that is okay. Next slide. Now, what are the various causes of wart? अगर हम from homeopathic point of view से देखें, so the causes of the wart are weakened immune system, and normally when there is some kind of infection, metabolic disorders, it can be associated with diabetes, rheumatism, gout, some other diseases which can happen along with that, toxic exposure, hormonal changes. Basically कभी भी किसी भी reason से जब weakness of the body आ जाती है, especially when your pancreas, intestine, liver are getting impacted and there is some kind of emotional stress, these are the reasons which could be counted as the causes of the wart. But sometimes जरूरी नहीं होता हमें कोई actual में reason मिले. तो रीजन ढूंढने की बजाय we should go sometimes on the basis of therapeutics, basis of the presentation of the wart, basis of the problem which the wart is causing, which site it is present. All these will be the guiding symptoms for us to treat the warts. नॉर्मली पीपल जो कि ह्यूमिड और वार्म क्लाइमेट में रहते हैं उनमें वॉट्स ज्यादा दिखाई देते हैं, इन एक्सेप्ट फॉर द पीपल हु आर मतलब अगर कंपेयर कर ले पीपल हु आर लिविंग इन कोल्डर रीजन, उनके पास वॉट्स कम होते हैं बिकॉज देयर विल बी लेस ग्रोथ ऑफ द वायरस. नेक्स्ट. Now this page I got from one of the books which I have been using in treating the warts many times. ये मुझे एक मेरी सीनियर ने गिफ्ट करी थी ये बुक, उसका मैंने पेज दिखाया है. So the major principal remedies which have been used for treating the wart, we all know that, but still I just want to have a little revision about it. Calcarea car, causticum, dalcamara, natramur, nitric acid, rustox, sepia, sulfur, thuja. Apart from that, antium crude, arsenic, baryta, belladonna, hyposulf, lyco, natramur, phosphorus, phosphoric acid, silesia, staphylos aureus, all these are very, very helpful and good medicines for wart. Now, yeah. So how can we differentiate sometimes with the wart? Differentiation comes on if there is some kind of associated problem with the wart. Sometimes the warts might be bleeding. If the warts are bleeding, the first medicines to think of is acid nitricum. Even thuja works in that. But acid nitricum has been a very successful medicine for treating the bleeding warts. ओल्ड वार्ड्स, अगर कोई वार्ड बहुत पुराना हो गया है और बहुत सालों से किसी के पास है वैसे ही डॉर्मेंट पड़ा हुआ है, इन दैट केसेस वी कैन थिंक ऑफ कैलकेरिया, कॉस्टिकम, एसिड नाइट्रिकम, रस्टॉक्स एंड सल्फर. Again, we have to go for the mentals of these and then see which medicine will be the best suited. Inflamed warts, अगर आप कभी कभी वार्ड को देखें तो हमें लगेगा उसके सराउंडिंग जो एरियाज है, सराउंडिंग स्किन है, वो थोड़ी सी इन्फ्लेम्ड लगेगी. And it might be little painful because of the inflammation. In that case, causticum is the first medicine to be thought of. Apart from that, natrum sulf, natramur, all the natrum medicines will be helpful. Itching warts. Agar warts mein itching hai, in that case, euphrasia, phosphorus, again acid nitricum will be a very, very useful medicines. So this is what you can see as, there is no point reading all this, but based on the various symptoms, based on various kind of presentation or किस site पे है, हम ये medicines we can think of. Now let me give you little more detail about, you can say very specific what can be thought of with the, in case of warts. Yes, Dr. Deepak, next slide. Now, Thuja, again, we all know, has been a very successful medicines for treating the warts. Usually, for all the kind of warts, it should be not very frequently repeated, but should be used in the power 200 to 1 ml. Causticum gives us the indication when there are small warts all over the body, especially on the face, neck, and hands. Sabina can be thought of when there are fig warts, when they're present with some itching or burning sensation, and especially if they're present on the genital, in and around the genital areas, Sabina is a very good medicine. If warts are painful, mostly moist, syphilitic, then nitric acid can be thought of. Natrum sulph is a very commonly, it's a medicine which can be thought of as a general use to cure warts. When they are on the hands, not on the outer surface, but on the palm side, if they are present, then bufo can be thought of. Apart from acid nitricum, another medicine that can be used is cannabis indica. We will continue with this little presentation about what. Now, since we have the speaker of our today's lecture, Dr. Hira Aggarwal, I would like to tell a few things about Dr. Hira Aggarwal. Good evening, sir. Welcome to the session.
Good evening, sir. Very good evening, everybody.
Yes, sir. So we are really obliged, sir, that you accepted our invitation for coming to the session, because I know you have so much of experience in homeopathy, and will be really grateful that if you give some kind of good pass on your knowledge to us. And about Dr. Hira Aggarwal, little bit I would like to tell that he's a direct disciple of Professor George Vitolgus, and he has been associated with many reputed institutions. I know the list is endless, so I don't want to name all of them, but he is a great renowned homeopath, and he has worked as professor in materia medica in a few colleges, like in Solapur, in GNR Homeopathic Medical College he was posted. He has given many good presentations in many different international conferences, and the most recent one I think was on oncology. So before wasting time, I would like to hand over to Dr. Hira Lal. Please, sir.
Good evening, one and all. Thankful, Shilpi, for your kindness to introduce me. My friend Dr. Deepak has been always after me to give some time of sharing the experience. Rather, it gives me an opportunity always to share whatever experience, little experience I have of 40 years. I am really happy that to make homeopathy strong day by day, we need a lot of interaction among homeopaths, always also among homeopaths and students. The new budding homeopaths are should be more stronger than before, because they should learn from the experiences that the new budding homeopaths are coming now. The government also being very strong for the alternative medicine. Homeopathy are having now very good golden days to the new generation will not have that amount of struggle as we all had in our days. People are aware of homeopathy. People know what homeopathy is, and the pandemic itself has given a very good glow to homeopathy. So with this, And really, we homeopaths are fortunate that by God's grace and parents' blessings, we are in this field of homeopathy, because homeopathy has a lot of merits. If you see, if you create your identity as homeopaths, you are a master of all. You are a specialty in your own self, in all the systems that you have in the body. You can be a pediatrician, you can be a gynecologist, you can be an ENT surgeon, you can be an oncologist, you can be a dermatologist. So the list is endless. You cannot say no to any of the diseases of the body, and you can heal them very well. What is required is, we are away one dose only away. If you put the correct simillimum, I think you start getting results and you see the change in the patient, because we have seen, because homeopathy has people that are coming to homeopathy are always coming after allopathy, after having a lot of failures with the modern medicine, or when they are tired with modern medicine. So we homeopaths should be proud, and we should do our work very meticulously. If you do our work very meticulously, judiciously, and with constant hard work and polishing ourselves each time, homeopathy will never fail you. You will never see back, and sky is the limit. So with these few words, we will start with today's topic of skin and homeopathy. Will you share the screen, Shilpi, or I will
Yes,
share?
yes, sir. You can also share, sir.
I will share.
Yeah.
So first of all, I am thankful to Orbit Clinics, its directors, and all the members of the clinic. They have taken an initiative to help our students, the budding homeopaths, to see how homeopathy can be applied in practical senses or practical applications in practical clinics. So I'm thankful for them, and we wish all those people, all the organization, all the team, hearty success and hearty congratulations. So we will first see, today we have skin, as Shilpi has given you a lot of understanding. Before I was unable to hear her, but whatever I heard little bit, skin is the outer covering of the body, and it is the protective layer of the whole body. It bears all the blunts, problems before anything goes inside the body. So it's vulnerable to many things, to the climate, to the injuries, not only physically from what you see outside, but it is also a seat of mental, emotional disturbances. What we have seen in homeopathy, the mental emotional turmoil can also be seen or predicted or analyzed on this outer layer, that is the skin. And whenever a deep disturbance is seen on the skin, it is more easy to treat, rather than that disturbance going deep into the system, creating more turmoil in the deeper organs like blood pressure, diabetes, kidney failures, liver diseases, or heart diseases. So these are more easy to treat. Even in Herring's law, what we have seen is the disease has to go from within out. So already in skin diseases, the pathology is on the outer sphere of the body, that is the skin. Within out, from a more important organ to a less important organ, and from an upper, the direction is from upper to a lower situation. So in all of the skin diseases, the outer part of the human organism or human body is there, but it is difficult to treat. All skin diseases are difficult to treat. Why? Because it depends on the amount of turmoil, the amount of problem the person is facing. Some diseases are of the skin are infective, like we see here herpes simplex. You have chickenpox, you have measles. Though they are on the skin, but they are of infective pathology, or they are self-limiting. But though they are acute, self-limiting, yet they need to be treated because there is a lot of sequelae post such acute diseases. Like in herpes simplex, you get a lot of post-herpetic neuralgia, which is very, very difficult to treat, and patient suffers a lot of pain for very much long period of time. This, though it is infective, it can be treated very successfully without any post-residual complications of post-herpetic neuralgia. And the very common complaint that the patient comes is, first, initially, there is a pain around the nerve tract. It's mostly seen around the nerve tract. And then after a day or two, you see such vesicles coming up, and the vesicles are in the line of the nerves. Whenever you see the vesicles which are formed in the line of the nerves, this is a confirmatory mark or sign about herpes. And what you have is severe pain, severe burning pain, severe stitching pain. Pains are a lot. Even the clothes are difficult. The touch of the clothes becomes very difficult. So whenever you see such, you can clinch the diagnosis as herpes. The maximum complication that the person goes is post-herpetic neuralgia if not treated correctly. And how best is homeopathy? It is the best for post-herpetic neuralgia as well as post-herpetic neuralgia in herpes also. And what is the first remedy you think of is Rustox. Rustox and Rus Verineta. These are the first line remedies for herpes. Why? Because one, the vesicles that are there, whenever the vesicles are there and it's burning, the remedy is Rustox. But when you give Rus Verineta, whenever there is a cluster, like you see in this case, there is a cluster of the vesicles and there is a lot of redness around the areola, is a lot of redness is there. Thus, then Rus Verineta is more useful than Rustox. But out of so many cases, about, if I can give you a degree of understanding for Rustox, out of 10 cases, 8 cases will respond to you with Rustox alone. And you will see that in about 2 to 3 days time, the vesicles start becoming black and you can see the change, and there is no residual effect at all. Local application of Rustox can be done. One more home remedy for local application is Geru. In Hindi, it is called as Geru. What is that Geru? During Diwali festival, you paint your tulsis with Geru, or whenever there is a religious function, that Geru is used. It's a red sand found in type of soft rocks. You have to just crush it and put a lape of or a small lape of it on the affected area, which gives you a very soothing effect, more better than any lactocalamine lotion or any other lotions. So this is one of the areas where homeopathy has a very strong hold, and you can relieve the patient in a week's time. The fever, everything will. Other remedies do come if you see the therapeutics, but what we have seen clinically is Rustox is one of the best remedies which we can see for herpes. This is the post. This is 4-8 and this is 15-8. You see in a week's time everything cleared off. Now, Shilpi was talking about wasps. Now, in general, if you see, homeopathy has a very strong what we can say, leading role or dadagiri. If you want to be a real leading or a leader, you have to show results, and skin is one of the best because it can be seen. Something was there before and something has gone now. And how fast it will go, that is where the role of homeopathy is. These warts are one of the areas, they call it as viral warts, corns, warts. These are the areas where homeopathy leads any other pathy which is available today. Though warts are burnt or they do a lot of surgeries, yet they reappear again immediately, and that is why the only way it can be treated is homeopathically. I'll show you some cases of warts. You see, they are all known as viral warts, but these are genital warts. You see, the whole anus was blocked. It was very hard for the child to pass stools, and you could see everything was cleared up. Now, what is important in warts to be seen is, Shilpi already has given you the rubrics, but the location of the warts. You have a lot of various warts. They are isolated, they are smooth, they are warty, they are dry, they are hard. So various types of warts. So first you have to see what are the types of warts that you are having and the location of the warts. You will get remedies from the location of the warts. Now, if you see, the warts are on the fingers or on the nail beds, near the nails. The only remedy most strong is causticum. You have to go with causticum, and you need a repetition. Here, in cases of warts or also in herpes, you cannot give one dose and wait. You have to give frequent doses. In herpes, you need the stimulation of the immune system very strongly every 3 hours in water doses every 3 hours, so that the pain subsides. Once the pain subsides, then you can reduce the frequency of the medicine. But in warts also, it's not that you give a high dose of causticum or a high dose of Tuja and just wait. It's very difficult. Here you need to give the remedy. Maybe you can start the remedy with 33 times a day for a week and wait for a week and see what happens. If the things are shrinking a little bit, but they are not to that mark and new warts are coming up, then you can switch on to 200, because the location and type will tell you to stick the remedy. If you are sticking to the remedy and going slowly high, you will see that results are guaranteed. So warts is one of the situation. Warts over the eyes is again causticum on the eyelids. Near the nails is causticum. All surrounding the around the neck, they are large, jagged, smooth, calcareous thuja. So if you see your repertory, the repertory is very important. With the repertory, you have to go to the location and the type of warts. They are single, they are isolated, they are dry. So if you see that, you can get those rubrics and the group of remedies become very small. And if you see 2 or 3 remedies, you have to confirm the remedy by asking few specific symptoms of that remedy. And if they are confirming that, if you see causticum, you ask them about weather, which weather you are more better in, dry cold weather or wet cold weather. They will say that wet cold weather. You ask with them for what about desires and aversion. Do you like sweets? He'll say not much, or there will be an aversion of sweets. Do you have frequent colds? And if you get a cold, do you have any loss of voice? If he says yes, so you have to confirm your remedy by asking few keynotes of the remedy or some modalities of causticum. So this is how you have to confirm the remedy. So warts is one of the areas where you can show your leadership of homeopathy. Ringworms. Now, lot of cases of ringworms are coming today. Fungal infections, ringworms. One is urticaria. But urticaria, and somehow we don't know, but why urticarias have started up. But first we'll finish with ringworms. Ringworm or fungal infections are those infections, the name itself fungus, so they don't go away very fast. There is a lot of relapses, and wherever a small part remains, it again increases very fast. Even the dermatologists are fed up by giving various lotions, medicines, antifungal creams, but yet they are unable to clarify or nullify these fungal infections or ringworms. These are usually, the seat of action is around the genitals, gluteal area, axillary area, wherever there is folds, cubital fossa, it is mostly in the folds where the person perspires a lot. Now, perspiration aggravates these types of fungal infections and ringworms. You have two rubrics: perspiration aggravation and perspiration after. So you have to see both these rubrics in these cases. Eruptions in folds, you have graphites, you have murk, you have so many remedies. So you have to see both this way. Now, seeing those, the main thing that you have to see with ringworms and all this is the modalities. Major two modalities that are seen are better by warm or better by cold. Itching is better by warm or itching is better by cold. Itching is better by warm. Many of the people say itching is better by warm. You have very few remedies coming up are arsenic, tuberculinum, and Hipar. Better by cold are phosphorus, tellurium met, sepia is there. Sepia, you have intersecting of the ringworms. Whenever the eruptions intersect each other, sepia is the remedy. So if you see the group of remedies for ringworm, and now you have to try to correlate them with the modality. Tellurium is the best remedy. Intersecting rings only is one remedy, tellurium. Whenever there is an intersection of the ringworms, you have only one remedy, tellurium. And also tellurium is better by cold application. Cold water or cold application helps that itching. So only remedy is tellurium. You also have sulfur, graphites, calcarea. Apis also is better by cold. But in general, you have to have that burning of apis, thirstlessness, industriousness, and the person is very hot. Sulfur is also hot. Then how will you differentiate sulfur with sulfur is a common denominator. Try to understand. In each case of skin diseases or other diseases also, sulfur is always there. Sulfur is known as a common denominator because sulfur leads in many of the symptoms and it's always there. So sulfur is definitely there, but how will you differentiate sulfur? That by generalities. It is hungry, it has specific appetite at 11 AM, desire for fat, desire for sweets, busy, untidy, does not want to share his things to others, fear of high places or vertigo of high places, burning of palm soles, wants fan, wants to keep his legs out from the cover. So these are the few things which you have to differentiate, or the hallmark of sulfur has to be there. Bacillinum can be used as a very good intercurrent remedy in all sorts of ringworms. Bacillum is needed. Whenever you give a remedy and definitely there is a relapse. You can put tuberculinum or bacillinum. Tuberculinum, whenever its complements with arsenic, so whenever arsenic gives a partial relief, you can go intercurrent dose of tuberculinum and go back again to arsenic. But whenever tuberculinum is not helping, you have to think of bacillinum when there is a lot of thickness and discharge. Sepia again is in with lean thin people. What is more sepia is the dryness of emotions in sepia and aversion to milk and desire sour, and all those the generalities has to match. In one case, which was a very chronic case, syphilinum helped. Why? Because the only thing that we were getting very strong in that was night aggravation. Though all these cases have very strong night aggravations, and all in skin in general, the complaints of skin in general have night aggravation, because the patient is quiet at night, idle at night, has no thoughts, no work, and at that time many of the skin complaints are aggravated. But it does not mean that syphilinum should be given to everybody. But in this case, the other marks of syphilinum were the tidiness, the symptom of being very strongly tidy, salivation at night. Murk also has salivation at night, a lot of sweating and perspiration aggravation. These are the symptoms very strongly for Murk. And what else we can say to this patient? They should use loose clothes and cotton clothes. People using tight clothing should are more aggravated very strongly. So they should be given the hint of using very loose clothes, and all those inners should be more of cotton. Also, people who sweat a lot or who are doing a lot of labor work, they should have bath twice, morning and evening. Whenever they sweat, post sweating, they should have a bath. So these are few things that you should take care of. And I think ringworms and fungal infections is again a very good area for homeopathy. Third is urticaria, which is chronic, as well as we will go to psoriasis later on. Urticaria, which has been growing very fast today. You have every alternate day 1 or 2 cases of urticaria coming up, angioneurotic edema or urticaria. Urticaria is simple, but angioneurotic edema is more difficult or grave or serious, because it also gives a lot of swelling in the throat, which gives rise to a lot of respiratory difficulty and swallowing difficulty. The whole face, mouth, everything is swelling. Unfortunately, I could not put those photographs in this present situation, today's PPT. But angioneurotic edema is very strong and very fatal many a times. So you have to be very cautious with angioneurotic edemas. But urticarias, a lot of people are coming up. Allergy ahe. Mostly initially, it was mostly with food. Somebody has eaten sour, somebody has eaten gawar, or all those things, vanga, brinjal and all. They were getting such type of urticarias, and they were applying juices of onion juice, white onion juice to the body, and that was helping. But nowadays, rather than food, apart from food, apart from acidities, these urticarias have come up without any reason. People are unable to know why these are coming, but they are mostly now, what we have seen in many cases is some internal turmoil, some sort of suppression of anger, or some sort of suppression of emotions, anxieties and fear. One of the remedy known for urticaria from suppressed anger is Astragalus fulvus. If you read Astragalus fulvus, you will see that a lot of skin eruptions appear after suppressed anger. You have one more remedy which has suppressed anger, but rather than suppressed anger, it is more of indignation, Can anybody tell me the remedy from the group? Just open your mics or put your hand up, Deepak sir or Shilpi. I'm clear. I'm able to hear. There is a lot of interconnection, internet disturbance at my end. Are you? I'm getting clearly.
Yes, sir.
Yes, sir. We are able to hear you, sir.
Okay. Then I think we will learn more better rather than traffic. If the traffic goes both ways, much interaction. It should be. This is more like a learning and sharing with advice. We should talk, or then we have to keep a answer session at the end. Question answers become general. When we come to very specific questions, we have to be very specific, clear in understanding. The whole motto is wisdom is intelligence. Like if you read Croton Tig, I can show you. Croton Tig, if you can read the remedy, it has specific eruptions. And how those eruptions form is, there is first a vesicle, that vesicle breaks out, and wherever the water of the vesicle goes, you have the eruption coming up, which is burning. And
Sir,
that is
sir,
the
excuse me, sir. Sir, I think
Croton Tig.
internet.
Starts with the vesicle. Yes.
Sir, sir,
Yes.
are you listening me?
Yes. Yes.
Sir, I think now there is a network issue at your end, and your PowerPoint is not moving. It is stuck to a one slide. So please, if possible, you repeat uh, when you talk about the proton tick.
Yes, sir. Your voice is audible, but your slides are not moving. I think there was some connection issue. Sir asked one question about
Is my okay?
so your slide is not seen. Yeah.
Am I being here audible?
Yes, sir. You're audible, sir, but your
Are
slides are not seen. I think you're not sharing the PPT.
now you can see the psoriasis slide.
Yes, sir.
Are you seeing this?
Yes, sir. We can see that.
Is it okay now?
Yes, sir.
Shilpi, is it okay?
Yes, sir. It's seen, sir.
Can you see?
Yes, I can.
Okay. So now my question, anybody has answered?
So they're asking you to repeat the question again. I think because of internet issue, they were not able to hear the question again.
The question was, what is the remedy which is very strongly known for suppressed anger along with indignation? Which is a very strong remedy in the context for skin diseases.
So staphysagria.
Yes. Anything else? Anything else? How many people say staphysagria out of the whole group? 12 participants are there.
Excuse me.
Who said staphysagria?
Sir, Dr. Minu.
Okay. Minu Bhargava.
Yes, sir.
Very correct. Congratulations, Minu. Good. But what is the other remedy, which is very close to staphysagria? Any other remedy apart from staphysagria? Okay. Staphysagria is the correct remedy. Very correct remedy. The first remedy which cleanses for indignation and anger suppressed is staphysagria first. The second is Natrum muriaticum. Psoriasis. Now, if you definition of psoriasis, it is an autoimmune disorder of the hand. It has different types, gutta psoriasis. So all those types are there. Palmoplantar psoriasis. You have many which are there. Now, what we have seen in whatever psoriasis, what we have seen is, or what we have come across, or the whatever allopaths say, they say as autoimmune disorder. But what we homeopaths analyzed and have found that the main reason or the main cause for all such more than 80 to 90% cases of skin disorder and specifically psoriasis is the psychosomatic illness or the mental, emotional, psychological disturbance. And that is why it falls in the category of psychosomatic illness. This is more of a psychosomatic illness from our understanding rather than autoimmune disease, though they have labeled as autoimmune. From their angle, it is not treatable. From our angle, it is mostly treatable. And how can we say that you have cured psoriasis? At least 2 years. At least 2 years, minimum 2 years after the patient is free from all the patches and symptoms and the lesions. For 2 years, there should be no relapses. If a patient passes more than 2 years or lives for 2 years after the clearance of symptoms, no patches or no relapses are seen, then you can claim that you have cured psoriasis, because the disease itself has its own waxing and waning. What do you mean by waxing and waning? The disease becomes silent on its own, or the disease may have a very strong flare up on its own. It has its own waxing and waning. So many a times after giving the remedy, when the patient says I am better, we really don't know whether it is a medicinal effect or the disease itself has become silent. It's very difficult to understand. So we have to judge each time what is happening with the patient. When there is a flare-up, when there is a strong new lesions coming up or thickness is growing very strongly, we have to think whether our remedies aggravation is there or it is an aggravation or waxing of the disease process itself. So this is what a judgment has to be taken. And how will we judge that? Anybody? This is philosophy now. How will you judge that it is more an aggravation of our remedy or it is a definitely disease process aggravation? They should be unmuted and made to speak. They must speak. Then only we can.
Sir, your voice is little breaking. I think there is some kind of internet issue has again come up.
The question is, I hope everybody is hearing me clear. The question is, if there is an aggravation of the remedy itself, how will you differentiate between the two? That it is a disease aggravation or it is a medicinal aggravation? Anybody? This is philosophy, simple philosophy, what we have learned in philosophy. What happens after giving a remedy?
Sir, in the medicinal aggravation, there will be a feeling of general well-being.
Yes, very good. And in disease aggravation?
Sir, the person is more irritated or not feeling well.
Very correct. Very good. Again, Minu Bhargav gave the answer. Very good. So if it is a disease aggravation, you will have, in general, the patient is feeling better. The generalities that he is having good sleep, he is having good appetite, there is itching, but he is not disturbed by the itching. So the general feeling of well-being will be seen. While in disease aggravation, the whole system is in a turmoil and there will be irritability, loss of sleep, no appetite, all those things will be seen. So this is how you will judge the situation. Now, coming to the cases, as you have different types of cases, though the types are different, the way of analyzing, the way of case taking, the way of coming to the remedy remains the same. For us, it does not matter whether it is a gutte psoriasis or whether it is a plantoparpal psoriasis or whether it is any other type of psoriasis. Our way of analyzing, evaluating remains the same. So in these cases, the case taking has to be very meticulous, very clear, and you have to come to a cause of the problem. So how will you find the cause of the problem? When you take the, now whenever you take such cases, now you come to the case taking of such cases. Whenever you take such cases, and mostly all these skin cases are somewhere connected with the psychological aspect of the person, you have to first complete your whole case. Like you take the complaints, the location, sensation, modality, concomitants, other symptoms, then the physical generals, the past history. And after finishing, and when you come to the mentals, you take the mentals also. Do you like to be alone and all those things? And finally, now you have to ask how many years. He had already said that this started 2 years back. So now you have to ask him, this is the end question that you have to put to the person. Why? Because if you put this question before, and if there is some sort of psychological turmoil inside the whole system and you have that positivity coming up, the whole further questions, answers you will not get properly. The generals, the mentals, the physical general, the personal details you will not get, because the person now is entangled in the psychological state and he becomes disturbed. Then many a times they cry. So they become emotionally, there is an emotional breakdown. So you cannot get all other symptoms that you want to get before. So get all those clarity before, and then this will be the final question. What happened 2 years back that you have started with this? Because this is a stress related disease. They say nothing happened. You ask them, something happened. उधर कोई कारण था, कोई सोच था, फिकर था, चिंता थी, मन के विरुद्ध कोई घटना हुआ, क्या हुआ, what happened? Then they will come out with some stories. In all these cases of psoriasis, you have a lot of stories. And each story is unique and each story is different. And that is why we say that each case coming to the homeopath is a new world for us. Who will come with what story and what queries, we don't know. Now, in this case that you have here in front of you, so this was before. This story again goes this way, that he was a retired policeman. He had this on the whole of the body, and it was, the whole skin was shredding away the whole day and night. It used to shred, the whole skin would go away. After finishing the case, we asked him what happened. He said nothing happened. Then I said, it cannot come without that. You have to stress on that. These diseases will not appear on your body unless until you have some sort of psychological stress or mental stress. It is not a simple stress that my child are not learning, they are not doing the homework, they are not studying well. These are not, they are simple stress. The stress should correlate with the disease. Try to understand. This is one thing you have to always understand. This is not a simple disease. When they say that nothing happened, my children are not learning, those are simple things. Put them a question that there is a glass, and if I touch the glass breaks. Can it happen? It cannot happen. If the glass is breaking, it means it has to be pushed in a very strong way so that it had a fall and then it breaks. So if you are getting a turmoil of this cater or this understanding, there has to be a turmoil of that strong nature. And then they come out with the story. You have to be with them and try to dig them. The work of digging is the work of the homeopath. And then he came with the story that her daughter's marriage was fixed. Everything, the wedding ceremony was to be 15 days before. All things were done, the cards were done, everything were done, they were distributed. And finally, 8 days before, the daughter committed suicide. This was really shocking for him. But he said, then he told me that this happened. I said, what did you feel? क्या लगा आपको? कुछ नहीं, अच्छा हुआ, मर गई वो. How can it happen? A daughter whose marriage is to be fixed has committed suicide, and you feel better. It means what? You see, you have to be very cool, think what he's saying, how is he expressing, and what he wants to say or what is going on in his mind. This is where the homeopath is expected to understand. Then only you can clinch the cases, then only you can clinch the remedy. Otherwise, plainly, if you are seeing to the cases like it's a psoriasis, I have to give Natramur, I have to give Sorinum, it cannot happen. हाँ, बहुत अच्छा हुआ, मर गई अच्छा हुआ, वो मेरे को बोलती तो मैं ही मार डालता था. I am a police. I worked in the police. I retired as a police. I have 7 batches on my shoulder. I've done my work very well. She did not tell me. But what did you feel? He said, nothing I felt. I felt that it is done, it's good. Then why are you worried? He said, I'm worried because I retired from a high cater. I was a responsible person. I have 7 medals on my chest. And because of this incident, my nose has been cut in the social forum. So what will be the rubric? What will be the rubric? Yes, Milu Bhargav. You are one of the intelligent of the whole lot, I feel. What will be the first rubric that you will clinch there? उसने मेरा नाक काट दिया. And that is where he felt bad. That is where he felt insulted. That is where he felt loss of social position. So fear, loss of social position was the first rubric you have to take into consideration. And if you see that, what do you get? So everybody should be with their repertories and computers. Then only, this is how we have learned with Vitulkas. If you want to learn cases, you have to learn with whole of the materia medica and repertories. And if you see fear, social position about is, the first remedy is like 2-mark remedy is lycopodium and 1-mark remedy is Staphylococcus. And this is how Staphylococcus helped him. So how you can clinch Staphylococcus? How you are coming to the understanding of Staphylococcus? Though you don't have any other symptoms of Staphylococcus, yet Staphylococcus helped because that was the causative factor for the disease itself to come out. What are the other symptoms? There should be a confirmation. Yes, anybody? If you want to confirm Staphylococcus, what should be the other symptoms? Some more symptoms. Because you cannot give a remedy on one single symptom, though it is a causative factor. You have to have some supportive symptoms which are very clear and confirmed. So what will be those symptoms for Staphylococcus? It will be a learning of Staphylococcus. Whenever you are thinking of Staphylococcus, you should learn or you should have those remedies in that case. Then only you can think of Staphylococcus strongly and give Staphylococcus. What are those? Yes, anybody? I'm not having the list of how many people. The list is there, but I'm not getting their names. The one is, you should have asked for gum bleeding. Whenever you brush, do you have gum bleeding? If there is bleeding in the gums, that is one of the strongs in favor of that symptom, is in favor of Staphylococcus. The second is caries of teeth. Whenever you are angry, you have shivering of the hands. The anger, it shows in the shivering. A lot of shivering is there. Trembling, not shivering, but trembling. Shivering is a cold after cold. This is trembling of hands. And your voice becomes also trembling. There is a hoarseness in voice with the anger. And in the past history, there should be history of styes. Styes, if there is a past history of styes and past history of UTI infections. If you have these two past histories, apart from the present situation, you can very confidently rely on Staphylococcus and give the first remedy as Staphylococcus. But these are needed for you to give. You have suppressed emotions. Staphylococcus is one of the remedy for suppressed emotions. You have not expressed your emotions. A daughter-in-law is there and she has been suffering with all her emotions. She could not express her emotions to anywhere. Everything was suppressed. Whenever the emotions are suppressed, Staphylococcus is the most important remedy, and that is why it is also useful for what? Migraines, infertilities. In infertility, Staphylococcus is one of the remedy, because you have a lot of suppressions which are coming up, and you can, whenever there is, you see, and the Staphylococcus is very sweet, mild, cannot fight, but will resist. But there is a lot of internal turmoil, and she takes everything internally. So suppressed emotions, whenever you get that, you have to think of Staphylococcus. How will you think of natrum? We'll learn some remedies now. What will be natrum and what will be ignatia? Yes. Some symptoms of natrum, who can tell? Because seeing, you see, I can give you so many cases, but what the treating the case I have treated has no importance. Now this lady, you see, this lady has all over psoriasis, not a single inch in the body is having no patches. This is before, this is during, and this is after. You see, this lady is coming from a village. The story with her was the discord between the daughter-in-law and herself. Discords. So seeing these remedies, seeing these cases is not important. What is important is how to tackle them. How should we fight with the remedies? And if you see this set of psoriasis, the whole scenario comes with psychosomatic illness. And if you see the remedies that come very frequently are Staphylococcus, natrum, ignatia, sepia. Sulfur comes as an intercurrent remedy, but these are mostly the remedies that come up somewhere in life or somewhere. It is not that only one remedy will clear the whole case. Remember that also. There will be a series of remedies that are needed as they start unfolding. Then you will see from Staphylococcus they may go to natrum. From natrum they may go to sepia or ignatia. From there they may go to pulsatilla also. So as they unfold, you will see unfolding means what? Unfolding is not the unfolding of the disease itself, but there is an unfolding of the emotional aspect also. Whatever the person was emotionally blocked, emotionally hard, emotionally dry, now shows the emotions much better. How does our medicine work? Can anybody tell me? How does homeopathic medicine work in such cases of situations where there is a psychological imbalance, or there is a conflict, or there is a disappointment, or there is a deception? So these rubrics, elements from deception, elements from disappointment, elements from being deceived, elements from emotions suppressed, elements from fear, elements from anxiety, fear with, all these are very important rubrics in this situation when you get the real correct cause of the story. First, I will give you a small case, and then you tell me how our remedy helps organism to make them feel better, or they are cured from that. The case of migraine had come. Now here we are learning, so we are not restricting ourselves to skin, but we are restricting of learning to homeopathy. A case of migraine had come. A new daughter-in-law who had arrived in the house after about 6 to 8 months of spending time in the new house started having headaches, which were half headaches. That was diagnosed as migraine. Never in her life she had headaches before. So this was the first time. So the cause lies present situation, the present scenario. If she never had a headache before and it had started after coming back in the Sasural, then we have to understand what happened. So this, as always, there is a discord in the family, interpersonal relationship discord. And mostly the discord is seen between the mother-in-law and the daughter-in-law. This is very common. But how a person reacts to that discord is a difference of individuality. A very common example that I always give you, or always give to the patients also, that we bring ice cream. The ice cream is from the same shop. It is of the same flavor. It is prepared by the same company. It has the same batch number. And we are sitting in the same situation in the classroom or in the clinic. And we 5 people eat the same ice cream. But the presentation of the ice cream will be different. Some will have throat pain. Some will have coryza. Some will have asthma. Another will say, I will eat 2 cups more. The stimulus of ice cream remains the same, but it is the individual susceptibility and sensitivity which will give you the reaction. So you have to understand what the susceptibility and sensitivity, and how much susceptible and sensitive you are will give you the degree of reaction. A small irritation in the throat, a strong large tonsils and inflammation, susceptibility is more, sensitivity is more. So the way you react, the way you show the symptoms will give you the depth of the sensitivity and susceptibility. So this lady came with severe migraines. They were very terrible and bad. It was the discord as usual, but she presented with in the form of migraines. Severe bad migraines. The husband said, it is not my duty to manage between the two. You itself, you have to manage yourself with her, with the mother. So he moved away, and she could not say anything to the parents nor anybody else. No friends, nothing. And everything was kept inside. Headaches was very severe with all photophobia, vision disturbances, sensitivity to light, noise, everything. We took the case, we gave the remedy, and the patient is now better, totally better. Headaches gone. Now what happened? Who changed? How Natramur made the trick? How did she better? How is she better now? The mother-in-law is the same, the daughter-in-law is the same. Then what happened? I asked the lady, now who has changed? Does the mother-in-law does not give you those stinging words? He said, no, she's the same. She still talks the same. Then how is that you are not disturbed this time? Because she said, I know that she will say the same stinging words again. Initially, those same stinging words were disturbing you, but now they are not disturbing you. This is where homeopathy has created what? Created a situation of acceptance. You try to accept the situation, what you have around you. Once you start accepting, those things does not disturb you. And once they don't disturb you, your mind situation or mental emotional situation remains balanced. So homeopathy gives you acceptance. A child dies. The mother becomes like a statue. She sits there. She does not eat, does not weep, does not cry. The eyes are dry. She says that my child is 12 o'clock now. He will be coming. I have to prepare food for him. She's just like a mechanical robot. She's working around. And now you give Ignatia. The mother cries, sobs, and comes to normalcy. She now behaves like a normal mother. What happened? What was not accepted, that the child has died, the child is still alive, is now being accepted that the child has died. It gives you acceptance. Once you see, this is how homeopathy, you have to see the change in the mental emotional sphere. And as there are changes in the mental emotional sphere, you will see the changes on the physical level. And these are seen only in psychosomatic illnesses. Maybe psoriasis, maybe eczema, maybe migraine. All psychosomatic illnesses that we talk about, you have to correlate with the mental emotional sphere, and with your remedy, there should be healing, there should be tranquility, there should be a synchronization of the mental emotional levels. If those are getting balanced, you see that skin conditions or whatever the psychosomatic illnesses like migraines, BP, they all start settling down. Diabetes also, whenever it comes due to emotional turmoil. And you see that the person which was very dull, was not more open, starts talking, who was not very to Natramur or from Ignatia to Sepia. What is the hallmark of Ignatia? Anybody? Tell me 5 symptoms of Ignatia which are very strong and we should see. These are all mental emotional disturbances. Some day or the other, some time or the other, you will need Ignatia, Natramur, Pulsatilla, Sepia. These are there. But what is the time you should give? What we say trios in homeopathy: sulfur, calcarea, lipo, causticum, and colocin. They don't come one after another. It's not that today you give calcarea carb, after 8 days you give sulfur, then calcarea, then lipo. It's not like that. There has to be unfolding of the emotional system. There has to be unfolding of the symptoms. And from the symptomatology of sulfur, they now go to a symptomatology of calcarea. You see, sulfur is a hot person. Calcarea is a chilly person. Then he goes to a lipo state. The state has to change. Whenever we talk of trios, it is not just trios to be given one after the other. When you see complement or supplement remedies, why the relationships are important? Because of the mental emotional symptoms. There has to be some symptoms on the physical. Some symptoms on the emotional level. You have to give some time for the new remedy to appear very clearly, and then that is the time you have to put that remedy, and you will see that you will get further situations. From Ignatia to Natramur, how will they will go? What are the symptoms of Natramur we should please? Ignatia will have a lot of blockages, emotional blockages. They feel that there is something blocked in the throat. Swallowing is difficult. With every swallow, it goes down and up, down and up. Block in the throat, difficulty in swallowing. There is nothing in the throat, no inflammation, no swelling, nothing. But there is an obstruction, which is an emotional obstruction. This is again a situation. If they are sitting in the, while case taking, you will see, they will be taking deep breath without any reason. They have to take long breath, sighing, respiration, respiration, sighing. This is again a confirmatory symptom for ignatia. And what more on the physical level is, after the stress or after there is a change or start of the pathology, you see that there is an aversion to fruit and aversion to milk. Before, the person was liking milk, before the person was taking fruits. But since the deviation, since the turmoil, since the emotional imbalance, there has been an aversion. आजकल अच्छा नहीं लग रहा है फ्रूट साहब, आजकल हम लोग दूध नहीं पी रहे, पहले अच्छा लगता था पर आजकल नहीं अच्छा लग रहा. You have to always think of, these are small subtle things, but this will give you a change. There is some change which is going on in the system. Patient will say, मैं पहले बहुत मीठा खाता था, अभी बिल्कुल अच्छा नहीं लगता. From desire he is going to aversion. It's a very strong symptom we should rely upon. Desire sweet पहले था, पर अभी 1 महीना 2 महीना हो गया, देखो अच्छा नहीं लग रहा है 2 महीने से. फिर ये 2 महीने में क्या हुआ? Then if you correlate everything, you will see that there is some sort of situation that has changed. Now you have to take this symptom more strong rather than other symptom. If you see aversion sweet, then what you will see? Phosphorus is there, causticum is there. क्या हुआ भाई? फिर if you ask those symptoms or remedies of those symptoms of those remedies more, you will get some more symptoms coming up. So these subtle changes, these small changes, these small turnings, after giving ignatia, you will see that the person is eating fruits now. The person is desiring or liking milk now. The sighing respiration has gone. The block in the throat has gone. Now she may go to a state of natrum where she will have headaches now. The vagus nerve is getting blocked, is getting choked, and that is why there is a sighing respiration with ignatia. It's a choke, it is a block that has come up due to emotional situation. Very early ages, you get cervical spondylosis or cervical pain. With that, they have pain from the cervical region to both the arms and both the hands. Here, this is the space for responsibility. Whenever a person undergoes over responsibility, they start with cervical spondylosis or cervical pain. You have to check for over responsibility. Now the young generation, which are oriented for high career, they are taking a lot of responsibility, a lot of things have been pumped on there. They have to do all those things. Whenever they are unable to do that, they get cervical pain. And we say that it is because of the computer. No, it's over responsibility. They are unable to manage that responsibility. Then the cervical pain starts. If you see over responsibility, remedies in over responsibility, you will get the remedy for the person. So this is how you have to analyze cases. You have to be very meticulous with your cases. These subtle changes, we were talking about natrum mur. What is in natrum mur? Headaches, very strong headaches, sun sensitivity, dryness. Now, general dryness that you see in natrum mur all over the skin, the throat is dry with desire for cold water. There is dryness in general. This dryness is also seen on the emotional aspect. And what is that dryness? They have very least friends. They have relationship one-to-one, one-to-family relationship. I like one and my family only. Is Kalikar. I have relationship one to the society. I like people. I am social. I like people to go around in society. I am running around. That is phosphorus. And one person who has the connection with the whole world is carcinosin. So you'll have to find out how is he, how much volatile is he. Whenever I see the TV and I see in the news that there is a river overflowing and the children have been carried away, the bus has been carried away, and she is crying here, it's carcinosin. You see some car and the animal is dying there on the road, she will go there, pull it out and cry, do something for that. call all the dogs on the street dogs and feed them in their house. These are all carcinosin people. They will be with nature. They will talk with the flowers. They will talk with the plants. These are people which are loving with nature. They are loving with whole world. These are carcinosins. Carcinosins are highly sensitive people. There also you have a lot of emotional suppressions. They cannot also fight for their own rights. So you have to understand this phosphorus is very social. And now a person who was very social has become closed. That is the pathology. Now you have to open up. What made him close? What incident made him close? You have to understand that. And your remedy should open it up. And from natrum, then he will go to fast. And you will see that what he was not eating before, now he will start eating now. That is where you have changed the person's emotional and physical aspect. Your remedy has changed. And that is the time when you have to think of another remedy. So giving remedies, you have to layer of ignatia has gone. Now the layer of natrum has come. Now you have to clear the layer of natrum. Now you have to bring to its original state. Once the person comes to the original state, then you have to forget that you have to treat him. So homeopathy has that strong cater, and only homeopathy has the capacity and the capability to touch the emotions, to heal the emotions, and to cure the emotions. You have a lot of cases today of disappointments, career disappointment, love disappointment, failure in examinations, with which they become psychological imbalanced. They go into dementia, they go into depression. Lot of things come up with the young generation. They go for careers and they fail there. So you see a lot of psychological imbalances which are coming, schizophrenic, because homeopathy heals the emotions. Homeopathy will clear the blocks in the emotions. You see, acceptance is what I'm saying. Infertility cases are coming. The groom says that I did not like the girl at all. You have closed yourself there only. Forget about how can you get fertility in such cases. The boy says I did not like the girl at all. So he has closed himself. So you have to open him up. You have to make him accept that yes, this has been done. Now this is yours and you have to accept it. That acceptance can be brought with homeopathy. And if you bring that acceptance, further results you will see with homeopathy. So that deep it works. But for that, homeopathy has that capacity. We have to work. We should sit. We should sit with the patient. There may be few patients initially for us, but the person which comes to you should be treated very beautifully, very well with us. The new homeopath should think that हमारे पास एक पेशेंट है, पेशेंट ने ये सोचो मत हमारे पास कितने हैं, पर जो आया है वो ठीक होना चाहिए, ये आप सोचो. अगर एक ठीक होता है तो 10 लेके आएगा, पर एक को ठीक करो. Be with him, try to understand him. Where is the problem? It is not that all cases will have mental emotional situation, but there is a connection always with the mental emotional situation, which creates a lot of ripple. And if you can balance that, it creates a lot of balance in the situation. Rheumatoid arthritis, you have a lot of emotional imbalance in rheumatoid arthritis. Arthritis also. To narrate you one case of arthritis, a lady came with severe effusion on the left knee. Many times the effusion was drained, but yet she was having that whole big leg. Same story again. We took the whole case and asked, finally, what happened? She had accompanied with her friend, lady friend. She said that there is a lot of stress in the house. This is only she said. Now, everybody is having stress nowadays. Remember, there is nobody, even the child going to school is having stress. He has a lot of full bag on his back with that stress of studies, with that stress of coaching, with that stress of passing examination, with that stress of getting marks, getting further admission is always there. But what is disturbing, what is creating a ripple in the organism is something that you have to understand. जो हमेशा डांटता रहता है, जो मन को सोने नहीं देता, जो मन को सताता है, जिस सोच ने आपका नींद हराम किया है, जिस सोच ने आपका खाना पीना बंद कर दिया है, वो सोच है जो आपको पकड़ना है. उस सोच को पकड़िए और वो सोच से उसको क्या होता है, कॉज फॉलोड बाय इफेक्ट. क्या है कॉज? कि बाबा मेरा बच्चा पढ़ नहीं रहा है, फिर क्या होता है, बहुत गुस्सा आता है. और गुस्सा से क्या होता है, गुस्सा बता नहीं सकते, नींद नहीं आता, सिर दर्द होता है. There is a discord. You have to have the whole scenario, then only you can get the whole remedy. Cause is what? Suppressed anger. What is the effect? Headache. Now what are the remedies with suppressed anger and headache? Then you will have to correlate, and from that group then you have to see the generalities. क्या है बाबा, desire for salt है, sun sensitivity है, face dry है, biting nails है. Yes, you are going towards natrum. Natrum car, very close to natrum board. Aversion to a person's face also. इतना aversion रहता है. Natrum has an aversion to people. Natrum does not like people with whom there is no good connection or no good coordination of mind. But what is natrum car? He will not even see the shakal of that person. वो उधर देखा तो इधर जाएगा. With sun sensitivity, with desire for sweet and aversion to milk, enough for natrum car. Even in infertility, you see now this applies in infertility. That I will not see the wife's face at all because I did not like her. And what is the physical symptom in natrum car? Spilling of the semen post coition. Only natrum car. Finished. Your case is finished. You have the confirmation that here there is a turmoil on the mental emotional level, on the physical level, everything spills out after relationship. Your remedy is natrum car. Finished. No need to do anything more. So you have to correlate the whole scenario from mind, emotion to physical to aversion, desires, and then you will see a very good straight line coming up. That is the best simillimum that you can derive or find out. And it happens. In most cases, it happens. Many cases, it happens. So, you have to be very patient, quiet, comfortable, sit. You have to be with the patient. You have to, your mind has to be free. That is why it is said. अपने दिमाग में जो भी कुछ रहेगा, पहले का पहला केस क्या आया, वैसा था, वैसा ये रहेगा. Don't understand that. Everything should be cleaned, whitewashed, and just be with the patient and think what is happening with him. And then you will see, you can understand them correctly. वो पहले वाला पेशेंट ऐसा था बोल के ये भी रहेगा, ऐसा नहीं सोचने. You have to be very clear. Each case is a new case, and each person is a new person. Add to that, I have left that story of the lady with knee fusion. So what was the stress? Try to understand why am I giving you this story, because this is how you will learn and try to understand and analyze cases. So she had her only daughter, which was studying in Bombay, had passed her final exams of engineering with flying colors. She was a gold medalist. She said, my daughter is in Mumbai. I said, then what happened? No, she is very good. Then I said, what happened then? If your daughter is in Mumbai, what happened? No, she has passed her final examination. I said, that is good. So what? If she has done good, she will pass in a good way. But my daughter has passed now. That is the only way she is saying. अभी वो पास हो गई ना. बोला अभी क्या होगा फिर पास हो. अच्छा है ना फिर. कुछ गड़बड़ है क्या तबीयत का? नहीं कुछ गड़बड़ नहीं. She is very good. She is really a very good daughter of mine. She is daughter of the mother. Then फिर फिकर क्यों करते हैं उसका इतना? नहीं तो फिर अभी शादी करना है, तो फिर क्या बात है? शादी तो करना ही पड़ेगा. अभी हो गया तो that is the next step that you have to think of. The story was this way. that the patient's husband and the patient's brother had a fight 20 years back for some reason, and they had lost her connection with the brother and parents. The lady, the patient lady, had lost the connection with the brother and parents. मतलब मायका उसका कट हो गया, मायका कट हो गया. The father had heart attack twice. She could not go to see him, nor she could speak with the father or mother. So she was in a terrible emotional turmoil. She could not even see last 20 years to them. Now she says, my daughter has passed. The only thing now is she is to get married. इसके मैरिज के बाद भी ये भी मेरे से कट होगी क्या? जैसा मेरा कट, मैं कट हुई मेरे माँ बाप से, ऐसे ये भी मेरे से कट होगी क्या? See what he is thinking. अभी तो होना जाना है, अभी तो कुछ नहीं हुआ, पर उसका डर अभी से उसको सता रहा है कि अभी वो पास हो गई है, अभी उसका साल 6 महीने में शादी करना है, तो ये भी मेरे से कट होगी क्या? And she started sobbing, crying. Remedy? Pulsatilla, severe forsaken feeling. You see, the remedies become so clear, so simple, but that story has to be understood. With every pathology, you should be with the patient. That is why a new case, you have to give time. Some people say, मैं रोज 150 केस देखता हूँ. I am said, okay, Baba, तुम्हारा system अलग है. But whatever I have done, you cannot finish a new case in 5 minutes. Forget it. Something is missing there. Or you have to be a very strong homeopath, sharp homeopath, which can do that. But I cannot do. But I have to be with this. And we have seen that very good. If you can show all these cases that you see leukoderma. Now you see leukoderma here. This lady of leukoderma. She came with depression. She lost her husband. She was an industrialist and everything shut down. Everything came down. She had only one daughter, no son. She was in a very bad depression, is what to do. She came for depression, but she had leukodermal patch under the skin. She did not say that I want to treatment for leukoderma. We gave the remedy aurum metallicum, and not only the depression went away, but the leukodermal patches also went. So you see how your remedy works. But which the leukodermal patches had not come after the depression; they were before the depression. But we gave the remedy aurum met for the depression. Not only the depression was better, but also the leukoderma went away. You see, this capacity of homeopathy to treat is something unbelievable. It has unbelievable capacity to treat. If you see or read old masters, what they have done is, we see in books and we say, "Aisa hota hai kya?" But what I have seen in my 40 years is, "Aisa hota hai, aisa hoega, aisa kar sakte hai," provided you stick to your fundamentals, you stick to your old masters, read the old masters. Read the old masters. They have done wonders. It may be any tuberculosis, tuberculoma, cancers. They have done everything. In children's thyroidism, if you read that, what is that book? I'm not forgetting the book's name. It's a small book. Thyroidism, role of thyroidism in children. Stunted growth. All those, they give thyroidism, they are out of it. Nosors by some very good person. It's a very small book. Nosors. He has talked only about nosors, thyroidism, and 3 or 4 remedies. You read Burnett's. How many cervical nodes, tubercular nodes have taken away by Burnett? Tumors and Burnett. Read old masters. You stick to your old principles, and I will say that homeopathy will not falter. It's a very big ocean. One life of 80 years is also insufficient to understand homeopathy and to really work with homeopathy. You need a furthermore 1 or 2 incarnations to really understand. That is the capacity. That is the power of homeopathy. It's very small time. I am now getting some understanding of homeopathy at this juncture of 40 years. How to go about, how to understand about. So I would request the budding homeopaths, I would request the younger generation to read old masters, not to juggle with cases. You really be with the cases, sit with them, try to understand with them. And you see, beautifully you can. A simple sign also can give you a remedy. There was a case of cancer, mammy. We were finding the remedies. And finally, when we was reading Lapis Alba, we saw that everything was Lapis Alba. And what was the Lapis Alba situation? That the tumor is not restricted to the skin, not adhered to the skin. And you can move the mammy along with the very few, 2 symptoms. Lapis Alba, the patient is quite well. So that is why it is said, diagnosis is not important for us. The patient is important, the symptoms is important. He may have cancer, he may have a tumor, he may have a psychosomatic illness, he may have any disease. Disease names are not important. He may have diabetes, he may have anything else. What is important is, are we able to analyze his physical, mental and emotional status? Are we finding a right remedy? And we are 1 remedy away. 1 dose of similimum can give you a very big change. The change will start immediately. So we can go more ahead, but we have to.
No, sir, thank you. Thank you, sir. I think you have 2 sessions, and the next session is on your 23rd of the Friday, same time. So you have 2 sessions in this entire course, and I know because Dr. Shilpi and other students are not knowing much more about you that you जब आप सब बोलने लगते हैं तो 1 घंटे बाद तो एक्चुअली आपकी स्पीड जो है वो आती है, मतलब होम्योपैथी का वो जो एसेंस है वो अब आने लगा है। तो जहाँ पे हम आपको अभी रोकने की कोशिश कर रहे हैं। तो मैं जानता हूँ सर, आपके पास इतना सारा मतलब एक ओशन है आप अपने आप में ही। हमारे स्टार वर्ड तो ओशन है ही है, लेकिन आप अपने आप में एक ओशन है। मैं जानता हूँ 2014 से हम लोग कनेक्टेड हैं, और जब भी मैं आपको सुनता हूँ तो हमेशा एक नई चीज, चाहे मैंने आपसे इग्निशिया 10 बार सुनी है, लेकिन हर बार इग्निशिया में एक नई चीज आप जरूर बता देते हैं। तो ये आपकी क्वालिटी है, इसलिए मैं आपको अपने आप में एक क्वेश्चन मानता हूँ। तो सो थैंक यू सर, हमारी पूरी एंटायर टीम की तरफ से। आज हमने जो आपसे सीखा वो काबिल तारीफ है, और आपका जो एक ये जो थीम है ना, कि जब तक हम उस पेशेंट की डिजीज प्रोग्रेशन को नहीं जानेंगे, मतलब एक्चुअली वो कहाँ से स्टार्ट हुई, हम लोग बस ये पूछते हैं कि वो 2 साल से हुई है, लेकिन वो 2 साल से नहीं हुई है, वो एक्चुअली कहीं और से शुरू हुई है, बस वो पकड़ना है। वो आ गया तो समझो मेडिसिन आ गई, आपके सामने बिल्कुल क्लियर एकदम ऐसे पिक्चर आती है कि हाँ यार ये है। और जैसा भी आपने कभी कहा कि नया केस 5 मिनट में नहीं लिया जाता, मैं तो अपने जितने भी स्टूडेंट हैं मैं तो कहता हूँ कभी कभी तो 1-1 साल में नहीं लिया जाता। कभी कभी तो ऐसा होता है कि हमें कई महीने बाद वो पिक्चर क्लियर होती है, या पेशेंट ये बता पाता है कि एक्चुअली में क्या था। बहुत बार ऐसा होता है कि हम लोग नहीं पकड़ पाते हैं, या शायद हम लोग अभी जूनियर हैं, लेकिन कभी कभी बहुत सारी बार ऐसा होता है कि पेशेंट इसी मूड में नहीं होता कि वो बताएगा, आज बताएगा, हो सकता है नेक्स्ट विजिट में बताए, हो सकता है नेक्स्ट विजिट में बताए। तो हमें जब तक वो फाइंड आउट या क्लियर पिक्चर नहीं होगी तब तक हमारी मेडिसिन जो है वो क्योरेटिव फॉर्म में तो नहीं जाएगी। सो दैट आई लर्निंग a lot of from you. So thank you, sir. Dr. Shilpi.
Yeah, thank you, sir, for such a wonderful session. मतलब इतना कुछ आपसे सिर्फ 1-1.5 घंटे में सीखने को मिला. I will be looking forward for your next session and many more sessions with us in Orbit Institute. Thanks a lot, sir, for explaining all the things इतने अच्छे से साफ करके, और आपकी मटेरिया मेडिका रिपोर्टरी की जो नॉलेज है वो सच में से डॉक्टर दीपक कई बार बोलते थे कि डॉक्टर हीरा लाल की मटेरिया मेडिका की नॉलेज बहुत अच्छी है, तो आज मैंने देख भी लिया, तो पूरा नहीं पता, बट स्टिल थैंक्स अ लॉट सर.
Thank you. It was a great time, and we feel that, or, rather, I feel that we should be in close connection. And exchange our ideas, exchange our thoughts, exchange our cases, so that each and everybody becomes polished and know what are the ways we can hold back our cases and we can give the best to the patients. We have to be best so that patients should come to homeopathy. We should force the patients to come to homeopathy. We should not force the government to put homeopathy on people. The people should say the government that we want homeopathy. And we are capable of doing that. We should do that. Every homeopath should do that. If everybody, you see, 80% of the cases we can treat. Routine patients kya hai? Acidity, gastrointestinal disorder, piles, fissure, fistula, sardi, khasi, bukhar. 80% of cases homeopathy treat kar sakta hai. 80, 20 जाने दो ना, सर्जरी जाने दो, ये जाने दो, जाने 80% cases अपन homeopathy treat कर सकते. So why not those 80% cases? We should take that. Acidity अपने जैसा किसी का नहीं है. खा के fistula, fissures, piles कितने हैं? रोज रेगुलर में 10 में से 5 लोग वही रहते हैं. So we should treat each and every case. 10 में से 9 तो ठीक होने चाहिए. Keep that in mind. होम्योपैथ का अच्छा होम्योपैथ कौन है? जिसका फाइल क्लोज हो रहा है. मेरे पास 2000 केस है और सब चालू है 10 साल से, तो कोई मतलब नहीं है. 2000 केस में मेरे 1800-1500 केस क्लोज हो गए, ठीक होके चले गए. That is the efficacy of homeopathy. This is how you should find the efficacy of homeopathy, by how much cases he has closed. Not that how much cases he has, but how much cases in a year he has closed is the efficacy of homeopathy should be known. Okay? Chalo. Good night.
Thank
Thank
you.
you.
Good night.
Thank you,
Thank
sir.
you, sir.
Thank you. Thank you so much.